So look, thank you very much all, and can I also say that this is the beginning of National Reconciliation Week, and so it kicked off yesterday, and it'll conclude on Sunday with Mabo Day. So happy Reconciliation Week to everybody, and hope that you can all get involved in one way or another. And so, whilst this is an IAHA webinar, it's also part of National Reconciliation Week and an event. Can I pay respects to Elders past and present? We're on Ngunnawal country here in Canberra, but I recognise the people wherever you are located, the traditional owners. My family roots come from Darwin, Iwija on my father's side, and Kungarakan on my mother's side, and so but I currently reside in Canberra. Part of this whole show is really to help celebrate in another day or so World No Tobacco Day, and what's very significant about that is that each year we have a different theme. This year, World No Tobacco Day, celebrated globally, does focus on heart health, cardiovascular health for people, because that's one of the most significant issues, which I'll touch on a bit later. I should also say at the outset that these slides will be available on the IAHA website, because you'll see that I've included links throughout, and their web links. But I've also just noted that it says it's muted.
Oh, no, it's still fine.
Still fine? Good.
Yeah. Let's just double check that. Yeah, we can hear you.
All right, super. Well done. You know, being the first, we're just sort of testing this little system out, which you can't do offline. But so you can hear me, so that's all good. So we've got World No Tobacco Day coming up on the 31st of May, which is very significant. Oh. So what I do by way of presentation is really just talk a little bit firstly about the Aboriginal and Torres Strait Islander population as we know it, some of the impacts of who's smoking amongst our population, looking at some of the impacts, and I'll close by going on and looking at some of the strategies that we can all apply to help address smoking, because it is a significant issue, and as IAHA members across the nation, you know, we have a role to play in making sure that you know, wherever possible, we don't smoke ourselves as health professionals, but also wherever we can influence how other people their smoking behaviours. But I think what we need to recognise at the very outset is that smoking is an addiction. It's something that people often can't control, but it's also a habit. For those that may not be addicted, they just you know, becomes a habit, whether it's socialisation or you know, lack of other meaningful activities to do, they tend to smoke, and I'll touch on some of those impacts a bit later. But firstly, by way of background, when we look at Aboriginal and Torres Strait Islander people, we are a very young population, with over 60% of our population under 30 and almost 50% under 20. So it's a very significant group that we have to look at in Indigenous affairs. And as I often say to ministers and government officials, that the issues that we are confronted with as a population group now are just going to compound if we don't really look at interventions. In our case, health interventions about smoking, but it goes across the board in all the interventions in relation to housing, education, employment, etc. So a very young population that is a growing population. And when we do compare that to the non-Indigenous population, and this slide, really the orange represents the non-Indigenous population, you can see that we're almost proportionally opposite, that we have a very young population with tapering off, as we get older versus the general population that's pretty stable throughout the life course, but also enjoys a very older and a longer life, which is depicted in these slides when you start to look at when people actually pass on, and we can see that the darker colour, the blue, represents Aboriginal and Torres Strait Islander people, and we have a very high infant mortality rate. Proportionally, we die throughout the life course. We don't have a long life compared to the non-Indigenous population that has they don't have a high infant mortality rate, and they live to a ripe old age. So what we've got to do in Indigenous affairs is to really try and replicate the non-Indigenous population. That's what health equality is about, that we all enjoy the same end outcomes. And so that's our challenge, is to try and address those issues of infant mortality, which we're seeing through the closing the gap targets is being addressed. In still a way to go, but we've seen some very significant improvements, and the trending is very positive. But when we think that our people die before they're 65 is very significant. And this graph, in fact, and why 65? Because that's an international measure, health measure of the health of a population, and you can see that 30% of Aboriginal and Torres Strait Islander people die before they're 65, and compared to only 9% of the general population. So that means that we have a fair bit to address if we want to have the same sort of outcomes as indicated in that previous slide. And so what are some of the major causes? Well, in our case, cardiovascular is the single biggest killer of Aboriginal and Torres Strait Islander people, cardiovascular disease, followed by cancers and a few others. So almost 50% of our major causes of death come down to two diseases, cancers and cardiovascular. And we do know that both of those are significantly impacted by smoking. And that's why World No Tobacco this year does focus on cardiovascular disease as an issue that we globally have to address. The issue, though, is that whilst cardiovascular is currently the -- cause of death, cancer is very much creeping up. And I've got some slides a bit later that will show you that and some of the reasons why that is an issue for us to consider. But I think it is a significant issue that we have to address in the coming years. When we look at those chronic disease risk factors, we also see that smoking is very significant, but some of the challenges that we have as Aboriginal and Torres Strait Islander people relate to obesity, and that's one of the contributors to that is overeating, poor foods, etc., but also physical inactivity, and for many people, access to good quality fruit and vegetables on a regular basis in an affordable way. So while smoking is down a little bit, we still see that it's a very significant issue. And for those who like to criticise us as a peoples and suggesting that alcohol is the single biggest issue that we've got to face, I'm afraid they're wrong. Alcohol is down the rung a bit, but alcohol does contribute not to death necessarily of our people, although it's fairly reasonable, the number, but it's all the social issues that impact on us and those social behaviours that we have to address. So it's not suggesting that alcohol is not an issue that we have to address, but it is not the issue across Aboriginal and Torres Strait Islander society. And neither is drugs, other than the legal drug of smoking that we get access to. So if we start to look at the number of, the proportion of people exposed to tobacco in a household, we can see that that's fairly significant. And whilst in the non-remote area, we're seeing a significant drop, 65 down to 53% in the last decade and a bit. We're seeing in remote areas, there's not a great deal of movement, and that's what we have to address. And especially when you compare the exposure as experienced by the non-Indigenous population, which is significantly lower than ours. So a major challenge that we have is to look at those younger children, the 0 to 14, who are exposed in the household, to daily smokers. Another depiction of that is when we start to look at who is the most exposed. We can see that people in cities do have a lesser exposure than people in very remote Australia. And so that throws a challenge. And you see that as we go through in a number of these slides, that the more remote you are, the greater the exposure to smoking or the incidence of smoking, and the greater exposure of our young people to smoking. This other slide is when we start to look at the age cohorts, we can see that is very high across all the age cohorts of Aboriginal and Torres Strait Islander peoples compared to the general population. But it's also about the daily smokers in households versus those who smoke indoors. So when we look at it from another angle, the proportion, and this is the again across the states and across the jurisdictions, as we say, we can see that places like the Northern Territory, very high exposure compared to the others. But in all areas, it's very significant, particularly in comparison to the general population. And so, a major challenge for us is to, as population health experts, or workers, is to look at how do we create the interventions that are going to make a difference. And I should say this is not just about health interventions. This is about education interventions, employment interventions, and housing interventions. And so how do we create healthy environments and provide that level of education to people to know the impacts of smoking, and particularly secondhand smoke, and those innocent younger people and the non-smokers who are impacted by the behaviours of the smokers. And so when we look at it an older cohort, and this is the 15 and over, who are smokers, you can see across the age cohort, it's very significant, and it starts to drop off as people get older, but that's in part because we start to drop off as a peoples, and so it's not something that we can think that it's people giving up necessarily. It's because there's much less of us there at that age cohort. But as you can see in this slide, the big challenges when 50% of your population or thereabouts across the age cohorts are smokers, then that's really the target group. But equally, it's not only the smokers, but it's those who don't smoke that we have to look at to make sure that we address both, and getting people to give up smoking, but also to look at those people who don't smoke to make sure that they don't take it up. We start to look at the other stats, and what's very encouraging is that when you start to look at the trending over the years, we can see that in the younger cohorts, we're starting to give up smoking at a much significant rate than the older cohort, where there's very little movement in real terms over the years. And so we're seeing successes in the younger ones, but not so much success in the older ones. But we've seen about a 10% drop in both male and female persons who are smoking. So that's positive, and that's also encouraging to know that the programs that we're using to encourage people to give up smoking or not take it up, they don't have a gender bias that needs to be addressed in those terms. But when we start to then again look at remoteness, we see that there is very, very little movement in remote communities. In fact, it's increased in very remote communities, the number of smokers compared to the major cities where we are seeing a movement. That's positive. So So it's as I said earlier, the further, the more remote you get, the greater the incidence of smoking. And when we start to look at the state territory breakdown, you can see where the big efforts really need to take place. New South Wales, Victoria doing well, Queensland's doing well, and then once you start to get to the others, South Australia's doing well, and Tasmania, but ACT, Northern Territory, and WA, we still need to have a bigger focus on some of the ways that we go about working with our population groups to make sure that we are able to see the change. But in saying that, I think the ACT is a bit different, and we've got to put in a bigger effort there. But remoteness is a significant contributor to both West Australia and Northern Territory when we look at the interventions, and that's why a lot of the focus, one of the priority areas of the new Tackling Indigenous Smoking program is around remoteness and addressing those groups. What we also don't think about in the whole smoking situation is the impacts on the environment of smoking. We talk about the environmental impacts in the home, but we don't talk about the impacts of cigarette butts. And for us as Aboriginal and Torres Strait Islander people who have a very close affinity to the country, the Mother Earth, we've got to respect Mother Earth and not go flicking those butts around either, because they have a significant impact, being non-degradable and so forth, and everything else that goes with it. And nothing's worse than going somewhere and you think you're in a pristine location and there's a cigarette butt laying around. So as smokers and as workers who are working with smokers and encouraging them to give up, we should also not forget the environmental impacts and remind people that the cigarette butts themselves are very toxic, because that's the filter that captures a lot of, but not all, of the toxicity in the cigarettes, is the one that's highly potent and does have an impact. But you can see again, there's a good link there, and that link is really worth having a look, because it's not only the cigarettes, but it also talks about e-cigarettes and the impact of e-cigarettes on the environment, when they're not appropriately disposed of, or even when they are appropriately disposed of, there is still waste there that we've got to address. So what about the impacts of smoking? Well, I'll leave this to you to really have a look at, but in your own time. But you can see on the left-hand side that there's hardly a part of your body that's not impacted by smoking, and that's what we've got to again talk to people about, and talk to them in a way that talks about the benefits of not smoking, even though we talk about the detriments of smoking and the health impacts. But I think a simple little graph like this is able to show people that and for us as Aboriginal and Torres Strait Islander people, we often think that it's only lung cancer that we've got to worry about. But boy, there's much more than lung cancer that we've got to worry about as a smoker. There's everything else. But then if you look at the benefits once you quit, you can see that they can be pretty rapid, particularly around the cardiovascular side of it. But once we get down to the cancers, they take a while to really address in a meaningful way. And I'll touch on that a bit later, because that's a very interesting discussion around understanding why cardiovascular is improving, but lung cancers or cancers generally attributed to smoking aren't really having that impact. But we do have a program called the Tackling Indigenous Smoking Initiative that's federally funded, and you may have seen that Minister White recently announced the 4 years of funding, $184 million, to the Tackling Indigenous Smoking program to go forward, because we've been able to demonstrate that we are having an impact on smokers, and there is a very positive impact, and I'll touch on that. But these are the components of the Tackling Indigenous Smoking program, and they will all exist into the future program, with the exception of the innovation grants. That's going to be they're no longer going to be a program, because the first round that we're currently funding, we've got to see the outcomes of those, because they were innovation grants to demonstrate new ways and different types of interventions that we could apply if we are going to make a difference, to smoking incidents. So, as you would have seen, one of the components is quitline, which is a very important, level of support for those who want to give up, and state and territory governments fund quitline themselves, but the government, the Commonwealth government, this program funds a quitline enhancement, which really does provide support to the quitline programs to make sure that all their counsellors are culturally competent, and also that wherever possible they could be encouraged to engage Aboriginal and Torres Strait Islander counsellors, so that when anybody wants to approach a quitline, then they can feel confident that if they want to, that they could talk to an Aboriginal or Torres Strait Islander counsellor, or if they're not available, that any of the counsellors in quitline are able to provide some level of support. This is an example of what's happening in Victoria, where there's a concerted effort by health, the Tackling Indigenous Smoking workers and health services to encourage people to approach quitline. We're seeing that they are doing so. Queensland, have got the highest level of quitline activity. A lot of it's self-referral, but it's also being referred by the health services as well as others. And what's important is that a referral to quitline, and you see this advertised everywhere, is really just a phone call away. And I'll just show you a very short little video, which, it will work. That will give you an idea about what quitline has to offer, and also declare that this quitline worker happens to be my nephew. So here goes. We've got volume.
Program coordinator at Quit Victoria. My work involves promoting the Aboriginal quitline to the Victorian Aboriginal community, and to get as many people to call and feel comfortable when they call up. When we're out at events, we love for people to come up and have a chat with us, and we just have a nice yarn, and we can talk about whatever they want to talk about. If we can go out to the community and be a service that helps them, and they feel trusted and know that everything they talk about with us is confidential, then it's really good that we can provide that service for them. Aboriginal quitline is a culturally appropriate and confidential service for the Aboriginal community, where they can chat to someone who may share the same experiences in life, or it may even have the same view on life as you. When you call 13-QUIT, request to speak to an Aboriginal quit specialist, and you'll be able to talk to one. If you're worried about calling the quit line, what you can do is hop on the website quit.org.au, follow the links, and you can fill out a form where you can get someone to call you back. One of the myths about the quit line is that one of the quit specialists is going to get you to quit on the day, and that's not the case at all. They're just there to help you and listen to your story and have a yarn really about what you want to chat about, whether you want to call for some extra information, whether it's nicotine replacement therapy support, whether it's information about what's going on with taxes and cigarettes. There's so much information that they're able to provide to you. If you want to increase your chance of quitting successfully, call us, and you'll be surprised about how friendly and approachable we are. Hi, I'm Jethro.
Good, Jethro. Well, we're going to be on
I'm proud Kulnara. Hi, I'm Jethro. I'm proud.
Escape.
There we go.
Well, that was lucky. Otherwise, we'd have Jethro all afternoon. No, a great advocate, young Jethro is, and as he said, quitline is an appropriate referral. not all states are able to maintain their Aboriginal and Torres Strait Islander counsellors, but as I said before, that they're at least trained up. Some of the other resources that are available out of the Tackling Indigenous Smoking program, I think the one that I continually promote for all workers in the health sector, but also bureaucrats in government departments and so forth, is the NACHO communique. It's a free publication, and you'll get alerts on the most contemporary health issues and other issues that impact on Aboriginal and Torres Strait Islander people, and they'll come on a very regular basis. So there's no excuse not to understand what's happening in Indigenous affairs and Indigenous health. We've also got the No Smokes website that's hosted by Ninty One, and what's good about that, it's got a lot of stories that people can listen to, small video clips about people's journeys, and it's also got the smoking calculator. And really, the one that's had a lot of good positive impact has been the My Quit Buddy app that's easily downloadable through the app stores. And for anybody who's contemplating quitting, or you'd like to encourage to think about quitting, pass on the link to the My Quit Buddy, because not only does it talk about the health implications, but it also gives you a sense of how much it's costing you to actually smoke. And I think that's one of the issues that many smokers don't consider, is really the impact of the economic impact of smoking, and particularly what that means to the family, people not being able to enjoy, taking a holiday, not being able to get access to good food, and to be able to afford good food and clothing, etc. Kids not being able to go onto excursions at school because there's no money in the household. But if we sit down and have a look at it and think about it, we suddenly find that that it's very significant. And a packet-a-day smoker can spend up to $7,000 or more a year just on cigarettes, and so that's a very significant loss of income to a household. And when you consider that often people who are smokers also have other behavioural challenges, like drinking alcohol and very exorbitant prices, or spending a lot of money on coffees, talking to their friends and so forth, and all of that costs money, and that is money that's lost to the family. Another very important resource that the Tackling Indigenous Smoking program offers are quit skills, and that's available free to any organisation, and that can be facilitated either going directly to Cancer Council Victoria, who funded to run this, or through the Tackling Indigenous Smoking officer, and we're located in 37 locations around Australia. Mainly 32 of them are with AMSs, but our staff can refer you on to these. So if you have an organisation or a group of organisations who want to go on a campaign to get a smoke-free policy in their organisation, or to understand about brief interventions and how that impacts, then this facility is available free of charge. You just got to be able to book it, and it fits into their program. And they've got a 2 and a 3 day program, that's directed to either people living in remote communities versus those living in more urban environments. But as you can see on here, there's a lot of issues that the courses cover, and it's all about techniques to be able to give up smoking and work your way through it. But equally important, they can also assist in providing guidance to develop smoke-free policies in workplaces that don't already have them. Now, the video I showed you on Jethro is also available through this one, Don't Make Smokes Your Story website, which is a Commonwealth Government program. You may have been aware that Senator Bridget McKenzie launched this in Alice Springs on Sunday, and the next round, and you'll see some ads in the paper on this. Don't Make Smokes Your Story, which is a 30-second or so ad on television that features Ted, is the most successful tobacco intervention program that's been shown on mainstream television. It has a significant impact for both Indigenous and non-Indigenous people who see this. They contemplate giving up smoking, and we're seeing a very high rate of people who look at this website, actually give up smoking. So it's around about 8%. So this is available, and I really urge you to show it in your organisation. If you're in an AMS, have it running in your foyers, in your waiting areas, so people can see it. And there's a wealth of other information that's available on the TIS website, which is hosted by Health Infonet, where you can see video clips from all over the nation that have been developed by Aboriginal people for Aboriginal and Torres Strait Islander people. And they're culturally very appropriate and very successful. There's a bit more, and there's the web link there for the No Smokes website, and the video that Jethro featured in is also on this website, and as well as a whole lot of hints and links to address a lot of the issues. Things like smokes also have a significant contributor to diabetes, etc. How to quit Quit for You, Quit for Two, which is all about focusing on mothers, pregnant mothers, and so forth. But you've got the links there, well worth looking at. And also, there'd be 20 or more videos on there of various aspects of quitting that you can have a look at. When we do talk about quitting, and we do talk about issues, strategies, ranging from brief interventions, which is just what a health professional can and must provide to their smoking clients, there's actually a flip chart that's been made available for Australian General Practice, and there's a link there on how to order this this flip chart and any other associated material, so that every health professional, including allied health professionals and paraprofessionals and associated, all the members, in fact, of IAHA, could get access to these and provide the brief intervention, provide the guidance, not only to clients but also to family. How do we encourage family to give up smoking? And this publication, which I'll look at, really does talk about the 5 A's. Ask about tobacco use, is a vital first step, and it's about saying, that's the brief intervention, asking people, what they're doing, assessing, from health professionals, and this is from a GP's perspective, assessing, their level of dependency to nicotine, and health services have all, not all, but most of them have got smokealizers that can actually test to see the level of addiction you have, the amount of carbon dioxide, monoxide in your body, which will help you out. Provide people with advice, provide them with assistance, and that assistance could be anything from referral to quit lines, to administering, patches or other nicotine replacement therapies, and support to assist people on their journey. And that'll depend on how addicted they are to nicotine versus the behavioural issue that we have to look at. And what's critically important in all of this, and the last of the 5 A's, is to arrange for a follow-up, to go back and talk to people, because the evidence, the research has shown that almost 90% plus of people who smoke want to give up smoking. And so, that's critically important. And it's just about how do we then assist those people to be able to take the journey and to give up. And so what we're now doing is, looking at it from brief interventions to straight out interventions on the referral to to NRTs, etc. We, if you're referring an Aboriginal or Torres Strait Islander client to an Aboriginal medical service, or even to a doctor, every Aboriginal or Torres Strait Islander person is eligible for 2 courses of nicotine replacement therapy, and that's free of charge. A Commonwealth program. Some states and territories provide nicotine replacement therapy support by way of patches or lozenges or inhalers and so forth at subsidised rates or very cheaply. Many AMSs are also providing that out of their non-TIS funding. So, there's that support through the 5 A's that we can do a brief intervention and take it further into a full intervention. When we look at, and this is, you can look at this at your leisure, this is really a take-up of a bit more elaboration on the slides I showed you before, the body and where it goes, but you can see that there's very high risk rates in all of these issues, from exposure to all the chemicals that are in a cigarette, to the impacts on various aspects of your life, and particularly around heart disease and the various cancers. And there's plenty of the cancers that are impacted by smoking. It goes on to things like hair loss, delayed wound healing, and that gets down to people who may have also, which a lot of our people have, comorbidities. They may have diabetes and are a smoker. We know that smoking also has an impact on the effectiveness of some medications, and particularly in researchers indicating that for medication related to depression or other retrovirals, for HIV and so forth, are really, once people give up smoking, that medication becomes far more effective than it is. And I've got some other slides on pregnancy, but which is a major issue. But when you start to look at the issues of children exposed to smoking, and you can see that it's not only the respiratory system, but also middle ear infection, also the eyes, they can cause blindness, or can cause, that's the chronic end of it, but not only for kids but for adults as well. It has an impact across the system, and that's really worth looking at. But when we start to look at, again, the benefits once you've stopped smoking, you can see that the benefits can happen fairly rapidly, particularly around your breathing and your lung capacity. But it takes a little while before it has an impact on your heart. And as far as the cancers go, I'll get onto that a bit later. That's improved, but we've still got potential for the development of cancers at a future time. Again, there are long-term benefits there. I was interested when I looked at this, the flip chart information that's being put out. I bet you a lot of the smokers wish that cigarettes were still worth $10 a packet. I'm sure that they're worth $30 to $40 a packet nowadays, and so you can see, you're looking at $8,000-$10,000 a year at $30, and just imagine what it's like over the life course, or even just in a few years, how much money is lost through smoking. The other important one is that when people are taking on the challenge, brief intervention is good, but some people do have more of an addiction, so they need some other support through the patches and Zyban and so forth to help reduce the withdrawals. And then we talk about, okay, well, there's the 4 Ds that we have to think about. Delaying, acting on delaying your urge to smoke, you know, and because a craving lasts between 3 and 5 minutes, and if you can get over that, then you've got a better chance of not wanting to look for a cigarette. You know, deep breathing. They talk about, you know, taking very long and slow breaths and slow releases. And if you do that, and it sort of gets down, and one of the things that we've been exercising, we've been doing in a leadership forum on tackling smoking that I've been convening around the nation, is getting into things like yoga or Tai Chi as alternatives activities for smokers to just, you know, take that few minutes to have I guess an alternative activity to thinking about smoking. And so you know, drinking a lot of water and but not swallowing. You know, it's just having it in your mouth and so forth, and you know, trying to do something else to take your mind off, and but also to try and identify those triggers. You know, is it when you're getting up first thing in the morning and looking for your cup of tea or coffee and then looking for a cigarette? Or is it, you know, the moment you see somebody or you go to the pub, you want to go and have a chat and have a cigarette? You know, look at what the triggers are for, and this is what you're encouraging people to do, to look at the triggers and then start to address them. And to remember that there's no such thing as just one smoke. You know, that there's no such thing as a safe smoking regime. It's all bad for you. And if you can stop from just taking one and hoping for the best, if you can avoid it, you've got a better chance of giving up. Now, I wanted to just talk a little bit about smoking in pregnancy, because I think that's a big issue for us. It's a challenge that we've got because still too many of our mothers are smoking for a whole range of different reasons, from thinking that it's going to be a stress reliever to having a smaller baby, etc. But it was an interesting fact the other day, is that whilst the baby may be smaller, the head size is still always going to be the same. And so it's not going to mean, you know, an easier birth for many cases, but to recognise that there are a lot of detrimental impacts, you know, on the unborn child. And then when you start to take into account things like epigenetics and the impact that has through the behaviours of the parents and the mother has on the child, then it becomes a real big issue. And it's something that's worth, if you know somebody who's pregnant and smoking, you know, really discourage them from maintaining their smoking and encourage them to give up and stay off the cigarettes. And you know, you know, it goes on to looking at you know, things like SIDS and you know, miscarriages and those other issues that we have to address. So you know, the whole thing that I mentioned, Quit for You, Quit for Two, that video, it's not trying to demonise women who smoke because we know it's an addiction, but it's about providing them the right sort of information so they can make an informed decision to give up. And you know, the health not only of themselves but of the unborn baby is really important. But also important is to be able to say to a pregnant mother and to the baby's father that if the mother doesn't smoke and the father smokes, then that has an equally bad impact on the baby. And so, you know, if partners smoke, go and smoke somewhere else, but not around mum and the baby. Support available through all your Aboriginal medical services, and there's plenty of them around the nation, 140 plus the TIS grant recipients that are located. They can provide population health type support. You've got, you know, clinics, you've got, you know, NGOs who are providing support, all the government offices. And remembering that as an Aboriginal and Torres Strait Islander person, you can encourage them to know that they've got 2 free courses of NRTs that they can avail of. And if they've got a really chronic issue and it's part of a chronic disease management program, they can probably get other support as well. So and let me just briefly in the closing sessions look at the tobacco story. And this is just the story of tobacco smoking for both the Indigenous and the non-Indigenous population. The lighter colour graphs are the mainstream activities and when interventions took place, and the grey ones are when the Indigenous specific activity came about. That's worth a read to understand a bit more later. But what I wanted to point out was that, you know, if you go back to 1990, was really the peak of smoking by Indigenous people. So that was what, 20, nearly 30 years ago that happened, that the peak, and they've been on a decline since then. Whereas for Aboriginal and Torres Strait Islander people, the peak, well, you could think that a peak might have been around about 2003. And so that's only 13 years ago. But it's been pretty stable up until 2008, when we started to see a bit of a decline, a much greater decline than this one actually shows. And you look at these figures, and it shows that that in the non-remote we've seen a significant decline in smoking. Remote is relatively stable, but overall we've seen a decline, which is good, you know, and that's since really 2008, when it started to really move. So we've seen, you know, a fairly significant decline in current smokers, a significant increase in those who have never smoked, and that's the really big target area, those who never smoked, they don't take it up. And they're very significant. So 1990, you know, nearly 30 years ago, non-Indigenous peaked, but in 2008, 10 years ago, Indigenous people peaked. Why that's important is that some research that Ray Lovett and his colleagues did really does look at the impacts of smoking on both cardiovascular and cancers. And what we know is that there's you see a fairly rapid outcome in cardiovascular, but in cancers it can be 20 to 30 years before it manifests into a decline. And that's the research that Ray and Kathy and Raglan did, and that's really shown, not in this slide, but this is just the one on the cardiovascular, and Nikki Winmar there talking about the issues and the impact. But what's stark is that 70% are more likely to die from heart disease for us. But what we do is we start to look at cancers. So we've seen a decline in cardiovascular, which is good, an improvement, I should say, less mortality. But when we get to cancers, we're seeing the non-Indigenous population, their mortality is actually decreasing, whereas the mortality for Indigenous people is increasing. And that is almost immediately attributed to the peak, when the peak took place for the non-Indigenous people. And we've seen a decline since the peak, and we're still coming off, we've still got some way to go, another decade or so, before Indigenous people's cancer mortality rate is going to improve, as it does with the non-Indigenous population. Now, I'll finish with a couple of slides, my favourites, my ones that I think we should all just be very conscious of, that racism stops with me. We all need to be very conscious that we shouldn't be perpetrators if we don't want to have racism inflicted on ourselves. And it's particularly important because racism has a significant impact on both physical and mental health. And so we need to address that. And this, there's a lot of campaign material available from the Human Rights website. This is one of my favourites, and it's Nelson Mandela really saying that, it's about learnt behaviours. If you can learn to hate, you can also learn to love. You've learned how to smoke, so you can unlearn how to smoke and give it up. So behaviours can change if we are minded to do so. And then finally, I finish with this one, which is again about discrimination, racism, intolerance, etc. making sure that we're not perpetrators, and look at our own behaviour. From the health professional side of it, it's very important that we look at that, because systemic racism, discrimination, does happen in our institutions and our hospitals and etc. So we just need to be mindful of our behaviours, and it's particularly, the unconscious bias that we might have through upbringing that we need to be addressing. So that gives you about 5 or 10 minutes for questions. So happy to respond to anything that you might have.
Okay. So we have 5 questions in the bank. We'll see if we can do a rapid fire.
Oh, yes.
And I think you got some from your nephew.
Yeah, I know. It'll be like that.
Okay, so first question from Tegan Tucker asked, is there a Cancer Council session available in Queensland for health professional updates?
Yes, I believe that there would be. If you go onto the Cancer Council website, that they should be able to provide that level of advice. But there's also, coming through, getting the updates from the other cancer councils can also provide that level of support to you, and as well as the TIS workers can put you onto the right sort of people to provide that update.
Great. And from Ruth, I'm not sure if we've answered this later on. What is the data on infant mortality in households where exposure in tobacco is 0 to 14-year-olds, and also in households with pregnant women?
Yeah, look, I don't recall seeing any specific data about infant mortality in relation to households in that age cohort, but one would suspect that in general terms, there would be a higher infant mortality due to cigarette smoke exposure. But we also know that we've seen the big gains in infant mortality being addressed through immunisation, and that's that's one of the big areas that still needs to be worked on, so we can get that full exposure to immunisation and the impacts of it. But if the other data is indicative that exposure in that early ages, and assuming mothers are in that cohort, then yes, we'll see mortality data there. But I don't recall seeing any specific data about that.
Yeah, and I think Ruth then asked again, among smokers, what is the level of smoking in numbers per day or nicotine milligrams per day?
Yeah. Well, it varies across the nation. Some of the work that's being done in the Northern Territory indicates that, and this is work by Professor David Thomas, and I hope I'm quoting him correctly, in that in many of our remoter communities, we can see that there's a higher incidence of smoking, but there's potentially a less number of cigarettes smoked. But, the key issue is that there's no such thing as a safe level of smoking. Exposure to cigarette smoke or smoking one cigarette can have a detrimental impact. So we try and, encourage people to give up full time, and to any smokers to go and smoke, if they must smoke, away from other people. Yep. And I think that David's doing more work, because the Northern Territory is the only jurisdiction where you can where outlets are required to report their sale, individual sales. So we can, in fact, over time find out and get an indication of the number of cigarettes being smoked within a community.
Yeah. And from Jethro, we've got GPs, health workers, nurses are able to refer clients to Aboriginal Indigenous Quitline for advice on how to stop smoking and best practice support. Referral numbers could be always higher. Do you recommend more action partnership between ARCHOs and Indigenous Quitlines? And to add in, what about allied health professionals?
Yes, and very much so. And I think, good question, Jethro, and it's incumbent on all of us to encourage people to go to a quit line if they can. And, as Jethro actually said in his video, that if people aren't able to hang on the line for a quit line, if they leave a message, quit line will ring them back. We've got situations in prisons now, and they're restricted on the amount of time that they can actually call out, but they are able to still communicate with Quitline and do it expediently. So we're seeing now a greater incidence of prisoners, people incarcerated, wanting to take on the challenge of quitting.
Okay, and our last question is, how important is it for ARCHOs and TIS teams to cross-promote the National Tobacco Campaign?
Yeah, look, I think very much so. The Don't Make Smokes Your Story is actually a mainstream program, even though it features Aboriginal and Torres Strait Islander people. The Quit for You, Quit for Two was mainstream. The Break the Chain was a mainstream activity. And so, look, across the board, be it the government or the NGO sector, are really promoting quitting and addressing smoking habits. Then all of them have got to work together, and we've all got to work together. But yes, use whatever means that are available to you. There's plenty of resources out there. I've put in quite a number of links there to that you can refer back to offline and get that material. But one of the great things about the tobacco control sector is that people are always very generous with their time, always willing to share material and experiences. If you look at the Tackling Indigenous Smoking website, that's on the Health Infonet site, the No Smokes website that Ninety One manages, the federal government's got a website, each of the cancer councils have got websites where there's a wealth of material out there. So it's a matter of giving people information to make an informed choice. And we want to empower the smokers to be able to give up and to be able to recognise that it is a challenge, it is an addiction for many, and that we have to really treat people with a bit of respect and a bit of dignity to help them in their challenge.
And sorry, we've just got one last question from Lisa. She's asked, I'm an allied health professional. What would you suggest as a culturally appropriate way to encourage smoking cessation in discussion with clients?
Yeah, look, I think the first thing is to do the brief intervention. Ask people, have they considered smoking? Considered stopping smoking, I should say. Which is the first step. If they have considered it or they'd like to consider it, refer them onto Quitline, or you can refer them onto any of the Aboriginal medical services, community-controlled Aboriginal medical services, because they have, facilities available to be able to counsel people, and many of them are now developing up that capacity to be able to do the one-on-one, smoking cessation workshops and taking people on that journey. But brief intervention is the first thing, and for you to be really successful or at least capable in that area is just upskilling through those various resources I've mentioned, to do it. The one website about the general practice put out, the flip chart, is a great one to have a look at, and that gives you no end of hints about how to go about it and how to refer on to a health professional.
Thank you. And I think one last question. Indigenous Allied Health Australia, we advocate that allied health is essential to that holistic delivery of healthcare. So what's kind of your view on the role of allied health in tackling Indigenous smoking and working with the broader health sector?
Yeah, look, my background's social work, and we interact with people all the time, and often it's people with from a low socioeconomic background, people with a whole range of challenges, and one of those may be smoking. And so, you know, that's a great time to have that discussion with people about, you know, if you're not able to cope to buy enough food, clothing, and so forth, have you thought about, you know, how much smoking is costing you? But to do it in a way that's you know, not disempowering, but giving people the confidence to have a go, and to do that follow up with them, but also to refer them onto the appropriate resources that are available out there. You know, there in the Northern Territory, they have the Quit 100 clubs where people in groups are able to go on the quit journey together. If there's a cohort of people that you have who have a common interest to want to give up, you know, refer them on to you know, the AMSs, or to the Tackling Indigenous Smoking Workers, who'll come and do a group session with them. There's a whole range of activities like deadly runners and deadly walkers around that are helping people to take their mind off smoking, and looking at different strategies. Because what really works is when you have a group of people who'll take that journey together and provide support to each other. And you know, I've found, you know, particularly in working with men's groups, that they often don't realise how much they're spending on cigarettes. And when they start to realise, they you know, they know that there's something that they can do to address that. And so we start to work on strategies that way.
Awesome. Well, I just want to say thank you for your time, Professor Calma. It's been really informative session, and what a way to start off this series of webinars. Hello, everyone who's still there. Thank you very much for joining us this evening.